My name's Joy Phyllis Mukaire, but I go by Joy. I work with Christian Health Association of Sudan as the executive director, based in Juba, but supporting work in the 10 states of southern Sudan. Ever since the separation, both governments demand that the church should no longer be one as Sudan. They should split and create a province in the north and a province in the south. Which idea churches for a long time resisted, but now they are trying to consider that. They believe that if they separate and if they divide the church, the north will be so small and they will be very oppressed without the south, the voice of the south. So together they thought they would be stronger. But now it's becoming obvious that they will have to think of creating the two. Yeah, the association actually is very ecumenical. It's founded by 7 churches. The Catholic Church in Sudan, the Episcopal Church of Sudan, the Presbyterian Church of Sudan, Orthodox Church, Coptic Orthodox Church, Africa Inland Church, the Interior Church, Sudan Interior Church, and some Pentecostal churches. And there is one called the Sudan Presbyterian Evangelical Church. So those are the founder bodies of this association. They are members of Sudan Council of Churches, and together they believe that they needed a health arm of the Sudan Council of Churches. And the ones that I've listed are the ones who are engaged in health. Almost every church works in curative services, simply to promote and increase access to the basic health package. They run clinics, mainly at the level of a health center, health units as well. They have community programs, outreach in terms of education, awareness raising, and service promotion. Some have health training institutions like the Catholic Church does. They do have a training school for clinical medicine up in Wow. So the membership is made up of hospitals, facilities, community programs, as well as training schools. And even the Presbyterian also have a training school for community midwives, which we've been supporting for several years. Training women to be midwives in the event that there are not many skilled people to be trained. There are many community health workers training institutions owned by the churches, and there are community midwifery training schools. Community midwifery would be at the level, which is a 2-year course, just like a course for community workers is also a 2-year course. Sudan is one of the places where the health workforce is very, very inadequate. There are not many skilled health professionals out there. In fact, I don't remember the figure of head, but the ratio of a skilled health professional to patient is so high that it's over 20,000 people. So there are very few midwives, and most of these facilities we are talking about, whether government or faith-based, are managed by people called community health workers. And the type of community health workers in South Sudan are individuals who have been trained for 2 years. It's a 2-year course. So they begin with accelerated learning because of the literacy level. So you can imagine. So the issues at hand, or the priorities, mainly maternal and child health, requiring more community level midwives and community level type of health providers other than doctors. The churches have sponsored us. As church, we have actually had a sponsorship fund for long-term medical training, what we call long-term medical training, sponsoring Sudanese nationals to go for midwifery, for nursing, for being clinical officers, and being community workers or being community midwives. We've had that sponsorship fund over the years, and we have some 46 people who have graduated from that. And it's just the desire to add to the numbers. There are just too few people who can provide services. Recently, we were part of the Health Systems 2020 program, and we came to be part of it, not as a sub-recipient but as a beneficiary. Abt and Associate, the prime for the Health Systems 2020 project, did identify the need to develop leadership and management in South Sudan, and did engage CHAS to mobilize and to coordinate this training of leaders. So we have benefited in that way, in that a number of trainers have been trained, and those trainers right now are training. So they keep the cycle going. So I would say yes, we've benefited from USAID funding through the Health System Strengthening Project. The case of Sudan is very unfortunate. The maternal mortality ratio is extremely high. It's 2,054 per 100,000. At the same time, the fertility rate is 6.7. At the same time, contraceptive prevalence rate is below 3%. At the same time, age at marriage is 13. So there's a whole range of issues to deal with in order for us to improve maternal health. So the government, of course, has made some progress in developing the strategic frameworks, developing some guidelines, improving on some of the referral hospitals. But more needs to be done, particularly at the community level, because what we know is that women don't necessarily go to health facilities. 88% deliver in the hands of traditional birth attendants or family members, and this is an issue. So we are dealing with a situation where first and foremost we have to do a lot of awareness raising and community education to engage the leaders and the influentials and the traditional system to know that it is important to save the mothers. And it is important if we work together, if they refer, if they recognize the need for individuals to visit the health facilities and be attended to as early as antenatal care time. So the case for South Sudan will work best if it is in the hands of community programs. And FBOs are well positioned for this. Our members are well positioned. They link up well with the traditional systems. They work with the communities. They are in the leadership role. They can motivate and initiate anything in the community. So we want to work with the religious leaders initially to let them know how important it is to save the mothers. People don't know. So we are hoping that we should be in a position to work with the religious leaders, through the cultural leaders, religious leaders, as well as the TBAs and other traditional healers for them to understand that we are dealing with a situation which requires a joint effort, and for us to focus on what exactly is the best thing for each one of us to do.